Hello everyone. This video is meant for a quick exam revision which will focus on one of the most important topic about, that is subarachnoid hemorrhage. What exactly is subarachnoid hemorrhage? It's a type of hemorrhagic stroke that occurs when the blood accumulates in the subarachnoid space. What is the most common cause? Most common cause of non-traumatic subarachnoid hemorrhage is rupture of an aneurysm. Okay. They can have a family history or risk factor of hypertension, smoking, or family history of aneurysm can be there. Okay. Classical presentation is sudden severe headache. Usually patient will describe it as the worst headache of his life. Okay. And what is the first investigation we do? That is the non-contrast CT scan of the head is done. If the CT scan turns out to be negative but clinically suspicious of subarachnoid hemorrhage, the next step is lumbar puncture, where we actually look for xanthochromia of in the CSF. So what is the major complication which can happen is there can be a rebleeding, or sometimes cerebral vasospasm can happen. Okay, so typically the vasospasm happens around day 7, and the drug of choice to prevent this vasospasm is nimodipine, usually given for 21 days, and this nimodipine will reduce the delayed cerebral ischemia, and sometimes it can improve the neurological outcome also in these patients. But the definitive treatment remains surgical clipping, or you can also do endovascular coiling. Ideally, remember, this should be done within 24 hours to prevent rebleeding. So just to remember the key important points, remember the most common cause of subarachnoid hemorrhage is ruptured aneurysm. The patient presents with a severe headache, which we usually describe it as thunderclap headache. And first you do a non-contrast CT head, and if it turns out to be negative, you do a lumbar puncture. And the drug which we give is nimodipine, because we need to prevent vasospasm, which is like one of the complication of subarachnoid hemorrhages, like a diffuse vasospasm happens. Okay, that can further worsen cerebral ischemia. That is why nimodipine is given. But the definitive treatment for subarachnoid hemorrhage is within 24 hours clipping or endovascular coiling needs to be done, and the vasospasm usually peaks around day 7. Okay, and one of the major early complication which can happen is rebleeding. And if you want more such videos, please subscribe to the channel.